So I am going to hand this over to Dr. Dan Other. Dan, are you there?
I'm here. Can you hear me?
You're there. So it is yours, and just tell me when to advance the slides, okay?
All right, fantastic. Thanks, Sarah. I appreciate it. Welcome, everybody. It is truly an honor to be able to speak with you today. Let me just let you in on a little secret. I'm an engineer and I practice healthcare. Now, you might be thinking, yes, but Dan, do you measure blood pressure? Or do you know how to provide the right prescription for somebody or give them the right medicines? And actually, no, I don't. I'm an engineer, and many people think that the job of engineers is to build things. And there's nothing wrong with building things. Of course, we do build things. But actually, the first goal of all engineers is to hold paramount the health, safety, and welfare of the public. Let me repeat that for those in the back row that weren't able to hear it. The primary purpose of engineering is to hold paramount the health, safety, and welfare of the public. In other words, you can't be any kind of engineer if you're not interested in health of the public as one of your primary drivers. I'm sure many of you in IPE classes are thinking, yeah, but we're talking about like the stuff at the bedside. And of course, as Sarah was talking about, Sustainable Development Goal number 3, good health and well-being, is a bedside type goal. This is the flag of Tanzania. This helps orient where Tanzania is located. It is in East Africa, just south of the Horn of Africa. It sits near Kenya. It sits near Rwanda and Burundi. And here's some interesting healthcare facts about Tanzania. In Tanzania, almost 400 women die for every 100,000 live births. That's a lot. If we would just kind of take an order of magnitude, if we called that 1,000 for every 100,000, think about how many that is. That's basically 1 in every 100. Now, it's not quite that bad, but could you imagine if you attended 100 live births and one of those women died? You would think that's an awful lot. If we compare this in this infographic to a place like the United Kingdom, where only 9 women die, that's almost 1,000 times better than the results in Tanzania. Now, again, rough numbers. Well, why is that? Well, part is that Tanzania often lacks access to healthcare facilities to be able to support births out in rural communities. Now, of course, you might say, yes, but can't we just do it by traveling midwives that visit in each home and help with births? And yes, that's great. We've done that in the United Kingdom. We've done that in the United States. But in reality, when births become problematic, in particular, in places like Tanzania, as babies become larger, because women are exposed to increased amounts of soda pop, so they're drinking more sugar and they're ending up with things that are closer to gestational diabetes or eclampsia, and they have bigger babies. Birth canals haven't gotten any larger. There are more complications. So building healthcare facilities where midwives and other kinds of providers can practice is super important to helping reverse the trend of high maternal mortality for live births in Tanzania. This is a picture of Sarah and I at a healthcare clinic that we helped design, raise funds for, and help support the construction of. And this is the only healthcare clinic that provides services for a catchment of about 25,000 people. So substantial numbers of babies are born there. And this is the kinds of projects that engineers interested in health, safety, and welfare and other healthcare professionals, be it pharmacists, nurses, physicians, whatever kind of health professional are working together. When we talk about good health and well-beings, we often think about access to healthcare in countries, whether it's the United States, in rural communities, or in countries around the world. On the next slide, we're going to see a further step into health, but looking at it in a slightly different fashion. Sustainable Development Goal number 6, clean water and sanitation. You might imagine, okay, so mom has baby and mom needs to take baby home. Well, you hope that mom is able to do exclusive breastfeeding through at least the first 6 months, if not the first couple of years. You're hoping that baby survives and does really well and grows and thrives and lives past the 2nd birthday, lives to the 5th birthday. We're hoping that these kinds of things occur. This is a picture of our family when we were working in rural Brazil in 2012. Now, many people have heard of the Amazon River, or you've heard about the Tapajos River, or you've heard about the Rio Negro. This is an image from an airplane of the Amazon River in white, with all of that fertilizer and soil merging together with the Rio Negro, black, dark water from all the tannins leaching out of the rainforest, joining a town called Manaus. Now, as you might imagine, healthcare providers want to send moms with babies home to thrive. Imagine if these were your water supplies. Imagine if your choice was a water supply that was contaminated with all kinds of material that came out of the forest that turned the water black. Or imagine if the water supply you were trying to drink was contaminated with pesticides and herbicides, and it was so white in color because of all the sediment in it that it was almost impossible to drink. How do moms stay hydrated so that they can do exclusive breastfeeding? How do young children have something to drink? Providing access to clean water supplies, adequate sanitation, and basic hygiene is a fantastic way to support health in developing communities. It's something healthcare professionals can work on together. But it doesn't just stop at clean water and sanitation. Water is our first nutrient. It's the first material we need. We are human beings, 70% water. The first thing we need to survive is water. But very quickly after that, we need food. And as we'll see on the next slide, Sustainable Development Goal number 2 is all about zero hunger around the world. Now, the picture here in the lower right is some friends of mine that work in Guatemala. These are native Guatemalan people helping people get access to clean drinking water. And the picture next to that is Sarah and I with our son in Antigua, Guatemala. On the lower left-hand side is the map of Guatemala, which is located in what you think of as Central America. Now, here's an interesting thing about Guatemala. If I was to ask most people, what language do they speak there? Many of us would say Spanish. Just like we would, if I was to ask what is a common language in the United States, many of us would say English. Well, actually, English is the language of the conquerors. It's not the language we speak here in North America. There would be native dialects, First Nations people. Actually, in much of Guatemala, a lot of the population still speaks native dialect, First Nations languages. In particular, they speak the Mayan dialect. As you move up into the hillsides, the mountainous regions of Guatemala, you find an indigenous population where Spanish is the second language, not the first language, where systematic discrimination against people who speak the Mayan dialect creates conditions where children are stunted. Now, the picture in the upper right-hand side comes from ABC News, and this is a picture of Guatemalan kids when they're right at 10 years old. You'll notice a couple of things here. There is a blue line behind these children which shows the height they should be at 9.5 years old. And the picture on the left are kids in Guatemala living in the mountains. And the picture on the right are children who are from Guatemala but have grown up in the United States. You'll notice a couple of things. The ones that have grown up in the United States and the ones that have grown up in Guatemala are very different in their height. They're also different in some of their body mass index. You see a little bit more chubbiness in the ones in the United States, a little bit more thinness in the ones that are in Guatemala, but most significantly, the ones in Guatemala suffer from a phenomenon called stunting. Stunting is low height for your age. These are all the same age children. They should more or less be the same height. And yet the ones living in the mountainous regions in Guatemala are stunted. Now, that doesn't mean that they're bad people. It doesn't mean that they're bad parents. The question is why? And it turns out that the children in Guatemala living in these indigenous communities eat corn that is processed in a way that sometimes grows a fungus on it. That fungus is called aspergillus. And aspergillus is known for releasing something called aflatoxin, which can harm your liver. So part of the association between aflatoxin and the quality of the corn you eat is related to the stunting of children. And one of the things interprofessional healthcare practitioners can do is help solve some of the issues of stunting. Now, you might be thinking, okay, Dan, you've talked about access to healthcare, and we get that. It makes sense. We want to build clinics. And you've talked about you send the mom and you send the child home and they need access to water and sanitation. That makes sense. And then you think about access to food, kind of the second nutrient you need. All of that seems like space where healthcare practitioners would regularly work, from the bedside to the home, starting to be out in the community. But that's not where health stops. And this is why the Sustainable Development Goals are so important. As we'll see on the next slide, there are additional things that drive healthiness that we can work on together. How about gender equity? In the country of India, there's a phenomenon known as male primogeniture. What that means is that men are the one who can inherit from their fathers. So a father has a son gets married and brings his wife to the family home, and the primary job of that wife is to produce a grandson to carry on the transmission of property for the family. Male primogeniture. Now, we can have our views on whether society needs to properly allocate resources to women. Certainly nobody is accusing India of trying to be bad to women by having male primogeniture. It is part of their cultural heritage. And whether we have a view on whether that is a good or not so good cultural heritage, what we don't have is a right to go and simply put down someone else's cultural heritage. But what we can do is work to understand it, and healthcare professionals together can work to address issues of gender equity, even while respecting differences in culture. In the lower right-hand side, that's a picture of Sarah and I at Gandhi's ashram in Ahmedabad, India. This is where Gandhi spent much of his time with his wife, Indira, cultivating their peaceful movement. That's actually a picture of Gandhi in the background with our kids and Sarah and I there. And one of the things that was really cool about working in India is we went from large cities like Bombay, or what you might know as Mumbai, out into rural communities. And when you get out into rural communities like these pictures that are in the upper right-hand side, what you discover is that you'll find women that leave their moms and move in with their in-laws. There's nothing wrong with that. So you have a grandfather, grandmother whose property this belongs to. It's their home. You have a son and a daughter-in-law, and they're living there with their family. And then that daughter-in-law is trying to produce the male offspring. So imagine if that daughter-in-law is feeling tremendous pressure to have boy babies. Who does she get advice from? Well, if she's living in her mother-in-law's home, if she is there with her husband, and part of her quote unquote job is to produce boy children, that is tremendous pressure. Imagine all the misinformation she receives. Imagine all the healthcare services she doesn't get supported by because she feels like she's got this overwhelming task to have a boy baby. Mobile health, or the ability to do peer-peer coaching, or midwife or nurse or healthcare practitioner coaching to women in rural communities, is a fantastic tool to support women in communities with male primogeniture. The idea is not to eliminate the culture that's there. The idea is to use technology to supplement part of the social isolation that women might be feeling when they live in their in-laws' home, away from their own parents, away from their own family, struggling with this job to produce boy children. Gender equity is an important part of the Sustainable Development Goals, but it is not the only one where we can work together as health professionals. As you'll see in the next slide, having access to a good job matters. One of the things we all learned during COVID was that people need money to be able to survive. And if you take away people's jobs, if you take away the way people earn money, their health diminishes. There is a long cohort study that took place in the UK called the Whitehall study. And basically it showed that the more money you have, the healthier you are. So Sarah and I worked on a project in Kenya. This is the flag of Kenya, and this is a map of where Kenya is located. Again, in East Africa, much closer to the Horn of Africa, nuzzled together between Uganda and Ethiopia. Somalia, it's in that East African region. And one of the things that we noticed working there was that many of the families were subsistence farmers. They would grow a crop of cassava, maybe they would grow a crop of sorghum, or maybe they'd grow a crop of corn. And so many of their days were spent waiting for their crop to grow. Now, there's not a whole lot of jobs in a rural village in the middle of Kenya. And if money equates to health, then what kind of jobs can you help rural Kenyans pick up on the side? How do rural Kenyans participate in the gig economy? Well, one of the things we did was introduced Wi-Fi and laptops. Now, you might think, yes, of course, there's the concern that bringing in laptops brings in some cultural intrusion, and can people be looking at things they shouldn't be looking at laptops, and can this bring in misinformation for news? And all of those social issues are there, but the benefit is that there's access to work. Now, all of you have done work on a computer not realizing it. If you've ever done CAPTCHA or reCAPTCHA, where you've seen these images that say, please click all the images that show a taxi cab, or please click all the images that show a pedestrian walking in a crosswalk, you were working for Google to provide data for Tesla to make sure that their cars don't run into things, right? An autopilot on a car needs to have humans tell it, this is a person walking in a crosswalk, this isn't. The car doesn't know that until somebody's programmed it properly. To supplement artificial intelligence, computers need curated data systems. They need data that's going to feed in that the computer knows matches human preferences, human knowledge. People working in Kenya in a village can do work like this. Now, you and I often do this work for free. We click these images. We don't really do it for free. It actually takes us some time. Companies, to identify that you're a person and not a bot, insert CAPTCHA into web pages. They pay for CAPTCHA to be a tool to identify a person and not a bot. To create larger data sets for companies like Tesla, individuals working in rural communities in Kenya are able to go through and process huge numbers of images. They can spend days at a time clicking on a screen. This is this, this is not this. One of the projects we worked on was air quality in urban communities, and we looked at images from Google Earth and asked simple questions like, are the windows open and closed on a home? We compared that to a geospatial map of allergies and occurrences of people visiting a health clinic, an emergency department, and we were able to look at air quality outdoors, the presence of open and closed windows, and people with allergies showing up to an emergency department. But what we needed to know is whether the windows were open and closed. We couldn't write a computer algorithm to look at a picture of a house and tell us how many windows were there and whether they were open and closed, but we could get villagers in Kenya to do this. And here's the cool thing about the money they earned. You would think maybe they would spend it on a better mobile phone. They spent it on education for their kids. They improved the future for their own children. They provided better nutrition so that their own children could go to school. They provided tuition so that their own children could go to school and learn. Imagine the tremendous benefit to the economy of Kenya for decent work and economic growth. And imagine the healthcare benefit that will accumulate there generation after generation because of meeting the Sustainable Development Goal. But what else? Let's take a peek at the next slide. How about the Caribbean? This is the flag of the island of Barbados. This is Sarah and our kiddos, Barney and Emma, at a fish market. And many of you might be very familiar with the Caribbean and imagine tropical storms, hurricanes passing through the Caribbean. You might think, why does that matter? I mean, don't we go back and help rebuild communities? And we do. But having access to seafood from artisanal fishers in these Caribbean communities is not only part of their culture, it's their main source of livelihood and a major source of their protein as part of their diet. Now, when a tropical storm goes through, one of the things that it does is it damages the boats. It causes fishers to lose access to their nets, to lose access to their lobster pots for catching fish and catching lobsters. If you don't have a boat and you don't have a fishing net, you can't very well fish. So what else do you do? Well, you turn to alternative incomes. One of those might be working in a hotel for tourists to come by. One of those might be helping the drug trade, smuggle drugs through the Caribbean into the United States. This is where the Sustainable Development Goals do a great job of starting to connect developing countries and developed countries. It is in the national security interest of the United States to help fishers in the Caribbean recover quickly after hurricanes. Because if they can stay as fishers, as opposed to working in hotels with tourists, or potentially getting into drug trafficking or other illegal activities, then not only have we supported their culture and their access to food and income, but we've actually done something that helps protect the United States. So one of the projects that Sarah and I got engaged with, and one of the ones that I drove forward in the Caribbean, is access to insurance for your boat, access to insurance for your fishing nets. Imagine if you're a fisher and you lose your boat, but an insurance policy will pay to replace it, you can get back to fishing. Fishers in the Caribbean generally don't have access to insurance. So one of the things I could do as an engineer was create a mathematical model that described the likelihood of you losing your fishing vessel. Now, you might think, as a pharmacist or as an occupational therapist or as a student studying nursing, why would an insurance policy for a fishing boat help with people's health? Well, because if you can culturally stay associated with fishing, if you can bring that source of animal protein to your family, if you have that source of livelihood so that you can be independent and self-reliant and take care of your family, there are all kinds of health benefits that accrue to helping support the Sustainable Development Goal of life below water. Like I said, the Sustainable Development Goals are a cool way to link developing countries and developed countries. Let's take a peek at the next slide. Here's some images of work that Sarah and I have done right here in rural Missouri. For about 3 years, we lived in one of those quote unquote tiny homes. Now, you might say, like, but how tiny? It had a bedroom and it had a kitchen living room area. That was it. Imagine your studio apartment that you might be living in as a student. We had a couple of kids living in that studio apartment. And one of the things that we would do is learn how to reconfigure just a few hundred square feet of living space, whether it was Sarah and I living there together, or with our first child, or with our second child, all living in just one bedroom and one great room, which was kitchen, living room, dining room, all of those together. Knowing how to consume responsibly is an important part of the Sustainable Development Goals. You, as a healthcare professional, need to understand that the consumption of plastics and materials in our healthcare system represents anywhere between 5 and 10% of total consumption of petrochemical-based materials in the United States. All those disposable syringes, all those plastic IV bags, all those beddings that you're sending to the washing machines over and over and over again are a huge environmental impact on the planet. Knowing how to be responsible consumers in your home and in the healthcare workplace is important. But it doesn't just include what you do in terms of what you consume. It's also what you do in terms of what you produce. One of the things Sarah and I have always done is promote local, sustainable gardening. Now, to be fair, Sarah and I can kill a plastic plant. We have absolutely, if there was an award for green thumb, we would get the award for the black thumb. We have no ability to grow anything. What we do have an ability to do is bring people together to organize around gardening and growing food. Now, you might think, I'm an engineer, I can think about the water and the soil, and I can design the plots and kind of organize this stuff and work on production. But let me tell you what you can't necessarily do as an engineer without giving it some intentional thought and collaborating with healthcare professionals. We're not very good at the stories and the connecting with the people in the garden. You see, gardens are not so much about growing food as they are about growing relationships. One of my most impactful personal experiences from working in the Rolla Community Garden was not about growing a tomato or growing some string beans. It was about a woman that explained to me that her son was being accused of murder and was potentially going to be put on death row. The opportunity for me to accompany and walk along with her while she experienced the trauma of dealing with being the mother of somebody who committed a capital crime was a fantastic opportunity for me to be a healthcare professional. Now, it's not the kind of thing I'm trained for as an engineer. I'm a whole lot better at organizing the size of the garden. But by working together with other healthcare professions, in particular, learning from healthcare professions that engage in the mental health space, I was at least able to listen and ask empathetic questions. I was able to be non-judgmental, and I was able to center the other person in my interaction with them. Now, I'm sure for you as healthcare professionals, you're like, damn, those sound like straightforward things that we always do in healthcare. But I'm going to let you in on a secret. Those aren't straightforward things for an engineer. There's a famous joke that goes, how do you know the extrovert engineer in the room? They're the one that's staring at the other person's shoes and not their own. Engineers aren't known for engaging with other people. I can go all day long without asking a colleague a question about how their day is going or what's going on in their life. It's not because there's something wrong with me or I'm bad. It's just not the way my brain works. I have to be really intentional, and I have to be coached and trained into how to be an empathetic listener. And imagine responsible consumption and production as part of the Sustainable Development Goals is my story of how I've learned to be a better healthcare professional and center the other person. Let's look at one more slide. I told you that we talked about decent work and economic growth in Kenya. I told you that we talked about good health and well-being in Tanzania. Turns out, the same kind of people that struggle with a job in rural Kenya, those farmers that can grow some crops but then sit around waiting for the next thing to do, you know what? In rural Missouri, it's a lot of the same. They'll plant grass and they'll wait for it to grow so that they can harvest hay, or they'll plant corn or soybean and they'll wait for it to grow so they can harvest. And it's not that they don't work hard while their crops are out in the field. It's not that they don't work hard the rest of the year. But given the technology, given the tractors and the farm implements, there's an awful lot of kind of downtime, especially for the workers that don't necessarily own the farms, the kind of displaced family members that are still living in rural communities. We were able to establish internet cafes in the gig economy where rural young people out here in the middle of nowhere, Missouri, were able to do some of the same kinds of work as people in rural Kenya. Now, we were able to significantly upscale the type of work they were doing. Imagine the kinds of work that you might do as part of the gig economy. That's the kind of stuff we were able to bring to people in rural Missouri for decent work and economic growth. Sarah and I helped build clinics in Tanzania to help moms get access to care. One of the things that I've been able to do with my engineering and health students that I collaborate with here in rural Missouri is put together programs where we educate home healthcare providers about how to take care of children. You see, in rural Missouri, when both mom and dad go back to work, who's left to raise Junior? In a bigger city, there might be a large healthcare facility. There might be a daycare, a nursing home. There's some place to take the children. In rural communities, there's fewer opportunities. Many times, kids stay with grandparents, or one stay-at-home parent will collect the kids from the neighborhood, 4, 5, 6 different kids, and they'll watch them. In fact, in Missouri, if you're a religious affiliated institution, you don't even have to answer some of the state regulations about the number of kids you're watching or the kinds of sanitary measures that you have to put in place. Religious daycares in the state of Missouri aren't regulated by state law the same way private or public daycares would be regulated. And the reason is because of a religious exemption, separation of church and state. One of the things we were able to do was to bring together the local police department, the local hospital, the local extension service, and students at the University of Missouri to offer a free day-long training to grandparents and informal care providers. We taught them things like infant CPR and child CPR. Now, we didn't certify them in CPR. We taught them rescue breathing techniques. We explained to them ideas about how do you sanitize in the kitchen and the benefits of using disposables as opposed to washing utensils. You would probably be surprised at the number of homes where people think that if they've got multiple children from multiple households, that as long as they wash the cups and knives and forks with some Dawn dish detergent in the sink, that everything is sanitized. And of course, you as healthcare providers would recognize, no, that's washing, not sanitizing. You've got to drop all of those utensils in a bin that has a little bit of Clorox bleach in it. That's how you sanitize. You wash, you rinse, you sanitize. As a healthcare professional, you know that. Lots of home healthcare providers don't. And so being able to provide good health and well-being in a rural community looks very similar to the kind of work that we would do in Tanzania. It's providing access to care that people didn't have, but given that it's a different culture, given that it's a different location, we have to provide different kind of training, different kind of access. The last slide is going to summarize a whole bunch of these into one piece with a bunch of different pictures. Out of the 17 goals and 150 plus individual targets, goal number 17 is my favorite. It's the partnership for the goals. This is what IPE is all about. And I've got some pictures in here that I want to show you. In the lower left, this is me and a couple of other folks who served as science advisors for Secretary Kerry. Secretary Kerry served as the United States Secretary of State during President Obama. Currently, for the Biden administration, Secretary Kerry is our global ambassador for climate change. I was very fortunate to be able to work as a science advisor for Secretary Kerry in his food security office. The work that I did in the Caribbean to develop an insurance policy to help fishers was funded directly by Secretary Kerry. Sitting down at a meeting with him and saying, we've got this really cool idea of a way to be able to help folks so that they can stay culturally connected to fishing, they can provide livelihood and good food for their family, they stay away from drug trade, it's good for the US, it's good for them, and he said, sounds awesome, let's go do it. The picture that's next to it on the right is me and a picture of Senator Simon Stiell. Now, Senator Stiell worked in the island of Grenada. He's very high up in their government, and he is currently the Executive Secretariat for the UNFCCC, the United Nations Climate Change Initiative. When you hear people talking about climate change and the United Nations solving the climate change crisis, Simon is the one leading that globally. Simon and I worked together in Grenada to develop the Fisheries insurance scheme. And Simon and I continue to work together globally to address issues of climate. The next picture over to the right is me participating in the lower right-hand side is me participating in an international summit held in Rome, Italy, by the Food and Agricultural Organization. This was in 2015, and Pope Francis introduced the Catholic Church's views on climate change. There is a paper that the Catholic Church has put out that describes not the Sustainable Development Goals and not climate change the way the UN talks about it, but discusses how Catholics can address climate change. That took place, the introduction of that paper, at a summit where I was representing the United States, explaining the work that we were doing in the Caribbean. So those are pictures about partnerships in diplomacy and global. The pictures at the top, the one in the upper left, is me with the Sigma Theta Tau Honor Society of Nursing current president Ken Dion. And the picture in the upper right-hand side, that's when Sarah and I were visiting India. And this is when I was giving a presentation at Hindija Hospital to obviously nursing students and early service nurses, talking about how engineers and nurses can partner together. I hope one of the things that I've left you with in this presentation is that engineers do more than build things. Engineering holds paramount the health, safety, and welfare of the public. And when you consider interprofessional education and interprofessional healthcare practice, one of the things you should be exploring is how you can collaborate together with additional professions like engineering, and how you can address the Sustainable Development Goals, local to global in developing communities around the world, as well as here in the United States. Thanks so much for your attention. I really appreciate the opportunity to speak with you today.
Well,